You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. On today's show, we take a special look at the latest phenomenon in medical and dental procedures, healing lasers. How do they work? What can they do? If this does half of what they say it will, you don't want to miss it. So stick around. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're very pleased to have in studio Dr. Joe Goth. Dr. Goth is a board-certified oral and maxillofacial surgeon with practices in Pittsburgh, Pennsylvania and Naples, Florida, and has been kind enough to come in today and discuss healing lasers with us. Dr. Goth, welcome to the show.
Thank you.
Okay, the laser, the healing laser. Now we know lasers can remove hair, they do all kinds of things. I came across this by accident. A doctor I did business with had one, worked on a finger of mine that's been a problem for 20 years, and the thing's like it was 20 years ago. Tell me a little bit about your involvement. You use this in your practice.
Yes, I do.
You do not work for the laser company. No. I brought you in just because you use this in your practice as long as anybody I could find. Tell me a little bit of how you use it.
Well, I initially got introduced to the laser about 2.5 years ago. I attended a meeting. At that meeting, I saw a direct correlation with using it on somebody at that meeting versus how I could use it in my practice. And so I immediately bought the laser because I saw it worked on an anesthesiologist friend of mine who had a jaw joint problem at that meeting. And in 10 minutes, using the laser on his jaw joint, it got him completely out of pain. He was able to open his jaw to a normal level.
Now, do you use it in conjunction with, because you are a surgeon, do you use it in conjunction with your surgeries?
Absolutely. I use it in conjunction with about everything I do in my practice. You know, for instance, I'll use it before surgery, I'll use it during surgery, after surgery to enhance healing. I'll use it on people who may not require surgery or as a non-surgical treatment, for instance, for temporomandibular joint problems or for muscle facial pain dysfunction. I might use it for somebody who has oral ulcers in their mouths that are very painful, and a simple use in 10 minutes will get them completely out of pain and almost heal the lesions as soon as possible.
All right, well then let's take a minute, and I know you brought some clips, but let's take a minute and kind of explain, because when I first saw this, you've been using it almost 2 years? A little over 2 years?
Yes, absolutely.
I interviewed doctors and dentists all over the country, and I, until recently, had never even knew about this. So take a moment, because it does seem like, I hate to say it, but it seems like snake oil when people start telling you how it works. You're like, come on. Take a minute and tell us how it does work, and then we'll watch your clip.
Well, it's very simple. This technology involves the use of light that enters tissues at a certain wavelength. And this particular laser will go anywhere from 1.5 to 1 3/4 inches deep because of its power. But because of how this laser is built, it isn't going to cause any damage to tissues, but it's going to enhance tissue healing capabilities. And the very simple way of doing that is it drives energy into cells, and it causes the production of energy within the cells in the form of ATP. ATP directly can act as, or has an anti-inflammatory effect.
All right, let's watch the video real quick, because until I saw it, it kind of helped me understand how this works. So let's take a second and watch this video.
High-intensity laser beams generated by the Lumix 2 can penetrate deep into tissues, including bone. As the laser light penetrates into the tissues, mild vibrations or pressure waves are induced within the cells. These vibrations signal the cell to produce proteins that it will use to repair itself. This is called the photomechanical effect.
Okay, so all they're saying basically is that the wavelength, because, you know, I talked to you, I said, lasers, every time I've had stuff done with lasers, they've burned stuff, they've heated stuff, they've cut stuff. Mm-hmm. And you said this is a cold laser, and I said, but how does it stimulate the cell? So it basically vibrates the cell?
Yes, it does.
Kind of like when you, and obviously not the same effect, but kind of like when you get a little massage, it creates that blood flow and that energy in the cell?
Yeah, absolutely.
And then because of that, damaged cells that were worked on, begin to heal quicker?
Absolutely. Cells heal quicker, and actually you get cellular replication of normal cells with this. So you're not only healing healthy cells, but you're adding more healthier cells on top of that.
So the question is, now you mentioned ATP.
Yes.
And ATP is part of a cell.
Yes.
That basically creates the food for the cell.
ATP is formed from little organelles within the cells called mitochondria. These are the energy-producing organelles within cells. And this laser is geared to hit the mitochondria, and then once it does that, the mitochondria will actually basically make this ATP, which is energy, which acts as an anti-inflammatory effect.
Okay, now I know you brought a little clip of that too. Let's take a real quick look at it.
At the same time that the laser is inducing the cell to produce proteins through the photomechanical effect, the laser is also stimulating the cell's mitochondria, causing it to produce ATP. ATP is the universal energy source for all cells.
All right, so it basically stimulates a cell to do what nature's going to make it do over a period of a month, to do that in just a much shorter time.
Yes.
Do you see, and I hate to even ask this, but 20 years ago they talked about arthroscopic surgery, you
Yes.
know, with tubes, and everybody said, whatever. Today we know it's a standard of care. Do
Yes.
you see this laser becoming that once people find out what it can really do? Because again, I told you when I first talked to you, it can help the pain medicine work better. It can also help get rid of the effects. You know, we talked about using on other parts of your body. Do you think as people know about this that it will become the standard of care? Do you think it's not now because everybody just doesn't know, or the technology is so new?
Well, I'm surprised that it isn't the standard of care right now. When I first purchased this laser 2 years ago and I saw what it did immediately, I basically would say to patients, in the next 3 to 5 years from 2 years ago, that this was going to represent the standard of care in the treatment of any type of painful syndrome in the human body. Now, 2 years later, where are we today? Well, we're still trying to promote this laser and making sure people are aware about it. But I would say in 3 to 4 to 5 years from now, it should represent the standard of care. It's the most non-invasive way of treating pain and other conditions that's out there today, and there's absolutely no risk or complications attached to it.
So there is no danger, and this is, again, you know, I said to you, my fear was, you know, you hear lasers, you know, obviously hair removal. I told you about the eyes. They do surgeries with them. They burn things off with them. This laser does not get hot. It does not. And you made a comment, and I said we weren't going to talk about
Yes.
it because it would scare everybody.
Right.
But you said that if regular lasers had the power of this, they could do some terrible damage to you. But this one doesn't do that because it cycles real fast. What causes it to be?
Well, it's a pulse wave laser, so it's going to cycle, and because it cycles, there's periods of time where it's not going to be doing any damage. And so basically what you could do is you could point this at the skin. I could point this at your shoulder for 24 hours, and you're not going to see any damage at all to the skin. Now, there's a law of diminishing returns in using this laser on the cells. The cells are only going to have so much time to produce energy, and once that energy is produced, then the cells are going to produce it anymore, but still firing at that cell is not going to injure the cell.
So if I put this on my leg where there's no problem, and I just held it there for, and the treatment with this is 2 minutes, you said, 3 minutes?
Well, it depends on the condition, anywhere from a couple of minutes to maybe 10 to 15 minutes.
Okay, so if I just were to put this on my leg
Yes.
and let it go, no damage.
No damage.
I wouldn't notice anything.
No.
Unless I had a spot. You even told me it can help with acne.
You might have a little pressure spot from just pressing the laser on there. It's a little
But it's not
circle,
gonna
but
hurt
it
the
goes
cells.
away. It goes
All
away
right, we've got to
immediately.
take a quick break. When we come back, I interviewed a couple other doctors. I'm going to show their clips, and I want to find out what kind of result differences, what kind of healing time differences you're seeing with this laser. You're watching Medical News Network. We're in studio with Dr. Goth talking about healing lasers. We'll be right back.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
No, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community.
Too strict. You're too
ConnectForKids.org, guidance for grown-ups.
Welcome back. We're in studio with Dr. Goth talking about healing lasers. All right, Doc, before we went to break, talked a little bit about how it worked and how it does what it does. I ask you, is there anything that you can't use on? Now, you're an oral maxillofacial surgeon. You do facelifts, you do facial reconstruction. Do you use it for all of that?
Yes, I do.
Do you use it for, you do implants, I know, you do all kinds of, is there anything healing-wise, and I know obviously the laser doesn't cut or do anything that's damaging, but is there anything that you can't use it on?
No, you can use it on every type of treatment modality, at least in my profession, you can use it on. Now lasers, this laser doesn't cut, but it heals. So in the face of surgery, like before, during, and after a surgical procedure,
so you can use it before surgery?
Absolutely.
It makes the tissue more resilient during surgery?
It allows for better healing.
All right. You made a comment to me about lacerations, because I know you do a lot of work with accident victims, repairing their face, and you talked to me about lacerations and what this laser can do. Tell me a little bit about that.
Well, if somebody cuts their face, they have a laceration, or they're in a car accident or something happens where they cut their face, use the laser at the time you repair, you do the soft tissue repair and you sew it up nicely, use the laser, and maybe I might use it 2 or 3 days in a row, and it'll completely abolish that scar. There will be either minimal or very little scar there compared to the normal healing processes in the human body.
Are you saying, and I know you do facelifts, you do some plastic surgery procedures.
Yes.
Are you saying even a plastic surgeon could use this to eliminate scars, to...
Absolutely. You know, it's perfect for any type of surgical procedure, whether a plastic surgeon, dermatologist, oral maxillofacial surgeon, or any other surgical specialist uses this laser. It's perfect for that. And why more practitioners aren't using this thing is beyond me.
All right. Well, with that said, I told you I found out about this, and I found you. I went to a doctor that I had interviewed before and was talking to him, and he used it on my finger and led me to the company. And so I went back out in preparation for today, and I interviewed him and asked him to tell me what the laser does for him. So let's take a look at his video real quick.
We use the laser called laser in our practice for patients that have pain. Either come in pain or they might be leaving with pain. In other words, if we use the laser for patients who have surgery. When the patient has surgery, we use it post-op for healing. And our experience has been that it cuts the time of healing by about 50%. I'd like to say more, but no one would believe it, so I'll say 50%. In fact, we just had just to prove it, what we did was we did a double sinus lift, bilateral, and with a sinus augmentation. And we, unfortunately for the patient, we only used the laser on one side just to see what the difference was. So on one side we did the laser, and the other side after the surgery, and the other side we did not. And they were both full flaps, full surgical procedures. Patient was intubated and asleep, and we used everything the same. They were done at the same time, and the laser was used on the first side, and the second side we did not use the laser. Patient came back 24 hours post-op, and there was a considerable amount of swelling more on the right side than there was on the left. And the patient came back 4 days later, which is normal what we do, to check if there's incision line opening for any protection. And we found that the side that had the laser was completely closed, sealed. It looked like it had been done about 3 weeks post-op. No swelling in the surgical area, where the other side the patient had a kind of a blackened eye, which could happen on either case, but it was ironic that the swelling on the cheek, the swelling around the sinus area, and the black eye was on the side that did not have the laser. But the healing sites heal much quicker, and that's by my experience. I know the research says that, but when it happens in your own hands, of course, it's really it's actually unbelievable. All my assistants use it. They've all been trained how to use it. The training took all of about 10 minutes, and it's so non-invasive, it's so simple to use, and it's so easy, and it's so safe. The patients have a feeling of they can't believe that just by placing this wand around them that they're all better. They just very excited. They of course, if they're in pain and then don't have pain, they're excited. Maybe I shouldn't tell people this, but I play golf, and every once in a while I jam my fingers, and I have a little arthritis in my finger here. So sometimes it gets so I can't move my hand, and as a surgeon, that's not a good idea to have a hand that doesn't move. So I use it on myself. I use it on my fingers, and I use it on my shoulder. I'm getting ready for a big tournament, so I gotta get my shoulder in shape. You know, now that I have this laser and I use it, and we use it every day in our practice now. In fact, when I take it home to use it on my wife and myself, I have to bring it back in the morning because the girls want it the next day for a patient. Because every day we have a patient that has a surgery or a patient that comes in pain, and I always say that in surgery or in dentistry that if the patient didn't have pain when they came in, they're going to have pain when they leave. So this is kind of nice. It's changed my practice around that when the patient comes in pain, they leave without pain, and if I work on them and do surgery, they leave without pain as well. You know, now that I have it, it's just an incredible internal marketing tool, because our patients go out and they actually tell other people that, you know, that when they come in, they had this problem, and when they left, they don't have the problem anymore. So they're excited, and they're actually now dragging patients in. So dollar for dollar, if it didn't do anything for the surgery, and if it didn't do anything for the pain factor, the fact that it's actually bringing patients in has become an incredible marketing tool, internal marketing tool, with us not having to do anything. The patients do it on their own. And so to tell you the truth, it's the best investment I ever made.
All right, Don.
True.
Now, he made mention in there, obviously, of the patients loving it. Do you have the same results?
Yes, absolutely.
Okay, the big thing he said to me is that he uses it on himself. And when you first showed up today, we started to talk a little about the laser, and you are guilty of the same thing.
Yes, yes, I am. Thankfully so.
And you use it on friends and anybody that around you. I mean, it almost, and again, I mentioned in the beginning, it almost seems you want to think it's snake oil. You know, we were talking about Dick Tracy, and I said, you know, in the 50s, he had the watch on his wrist, and everyone, oh, that'll never happen. And now we know that that's a possibility. Star Trek.
Absolutely.
The phaser, they would run over it, and it would cure, you know, this and cure that. Is that what this is?
Similar fashion. It's not going to do it as quickly as a phaser, but you're going to see remarkable results over time.
Does everybody, you know, you talk. Is everybody amazed once you use this on them the first time?
Initially, they're skeptical because they look at a small device like this, and they're thinking, well...
And this is the whole laser.
And I know what they're thinking. They're thinking, well, this thing isn't going to work. It's too small. Look at the size of this thing. And when you first use it, let's say you use it on somebody's jaw joint or maybe on their back, initially they'll get up after about 10 to 20 minutes, and they'll just kind of move around like they don't believe it. And I'll say, well, how do you feel? I say, well, I can move a little bit better. And then about a few minutes later, they're saying, you know what? My pain level's down. And all of a sudden, they're like shocked, but they're still skeptical until they might come back the next day, and I might use it on them again, because sometimes you have to use it sequential days in a row, 2 or 3 days in a row. But I'll tell you what, by then, they're believing in
And this is the whole thing, this little box. I mean, most lasers I've seen are big, giant things, and you got to wheel them around. This would take up no room in anybody's practice.
This is one of the models they have, and they have 2 other bigger models that are used for other technology. But this really is the key right here.
Sorry, we have to take another quick break. When we come back, I want to find out a little bit more from you about why you think everybody isn't using this yet. You're watching Medical News Network. I'm Mike Wittgenstein. We're in studio with Dr. Goth. We'll be right back.
This is the hand that sows the seed, that grows the forest, that gives shape to the wind, that carries the kite, that is flown by the child, that is loved by the woman, that gives to EarthShare, that supports the hand.
EarthShare is the workplace giving program bringing the leading environmental groups together. Support EarthShare, support them all. To learn more, please visit our website.
Welcome back. We're discussing healing lasers. All right, Dr. We've talked about a lot. We saw the interview. I kind of promised I wasn't going to put you on the spot, but during the break we talked a bit, and I asked you, why do you think everybody isn't using this laser? Because half of what you've told me is unbelievable, but I have to believe you because it happens in your practice every day. Dr. Feld said, happens in his practice every day. People love it. People want it. It gets people, you don't have to give them as much medicine. You don't have to, you talk to me about an impacted wisdom tooth, helping with that. Why isn't this in everybody's practice? Do you think it's because the public doesn't know and isn't demanding it? Do you think it's so new that it scares people? What do you think?
Well, I think first of all, the word isn't out about this technology yet. So I think we need to get the word out to the public and to other health practitioners, whoever they are, about information about this laser.
Not to put you on the spot, but in the 2 years that you've used this, and obviously in 2 years you've used it on hundreds, if not thousands of people, what problems, if any, have you had?
No problems.
Nothing.
In terms of using the laser, in terms of complications, or side effects?
Yeah,
Zero. No problems.
And you use it, does it help stimulate the bone if you do implants? Does it help? I mean, what is...
Well, it's a multifactorial thing, Mike. First of all, it's going to stimulate fibroblasts, which are the skin cells.
Right.
So skin's going to heal better. In my opinion, it stimulates the osteoblasts. In fact, research shows that it stimulates the osteoblasts. So if you cut a bone, you do an osteotomy on a jaw, you put a dental implant in, or you take out a wisdom tooth, it's going to allow that bone to heal quicker. I mean, how many people ever heard of dry sockets? Dry socket is an event where you take out a tooth, the blood clot falls out early, and there's pain. Well, in my practice, it's very rare to see a dry socket, but if somebody sends me a patient where another practitioner got a dry socket, and I use that laser on it, 5 to 10 minutes, that pain is gone. That area is treated, and that's the beauty of this laser.
All right, you mentioned to me during the break, and that's when I get my best information, you mentioned to me you had somebody come in that had heart problems or it had some other issues that was in extreme pain.
Yes.
Really couldn't take much medication.
Right.
You almost forgot you had the laser. Tell me a little bit what.
Well, the gentleman had heart disease. Long story short, he has an abscess tooth in his upper jaw, and I couldn't take it out that day because he's a medical risk. He had a heart attack recently. He has stents in his heart. It's not safe to do him in the office. So how do we treat this guy? Tradition tells us that we look at a patient, take an X-ray, put him on an antibiotic, give him a pain pill, and walk him out the door and schedule him 1 to 2 weeks from now for the surgery. Well, as I was walking him out the door, I realized that I had the laser. I said, "Come on back to this room. Let me put this on your tooth for 6 minutes." I basically said, I sat him down, I put it on the tooth for 6 minutes, and it was unbelievable. His pain went completely away. He walked out the door, he was completely comfortable. Of course, we still put him on the antibiotics, gave him the pain medication.
With that said, will it help that area where you treat? If you give the man antibiotics, will the fact that the cells are now actively producing energy or are alive and active, will it help them use the antibiotic to fight the infection?
Yes, it'll actually enhance the effects of the antibiotic.
So it will actually make the antibiotic work faster?
Yes, it will. Yes,
Okay.
it will. And it'll actually, and perhaps in a certain sort of way, cut down on the amount of pain medication he takes, and perhaps cut down on any anti-inflammatories he might have to take, and avoid maybe the side effects of those drugs.
All right, I have one more clip of a doctor I interviewed. I want you to watch again and tell me. They all are starting to sound, you sound the same, Dr. Feld. This is Dr. Alano out of Los Angeles. It's starting to me to be a repeating message here, so let's take a look at Dr. Alano.
I use the laser a lot for treating my TMJ patients. A lot of our TMJ patients are chronic pain patients, and they have a lot of inflammation, and we're able to use the Luminex very effectively in reducing inflammation and pain in the jaw joints and muscle trigger points, referred pain and muscles as well. I've seen it here in our dental practice since we're a group practice in post surgeries and reducing post-operative pain and complications. And so it's really done a wonderful job in terms of helping our patients without the use of not having to use a lot of medications such as drugs and anti-inflammatories and such. We don't. It's minimal for those patients. So our patients love it, and it's so easy to use. It's my assistants are the one that administer the laser, so it's great. I had a patient come in last week. She was in the emergency room with so much pain. The morphine didn't work for her. She came in, it was her jaw joints were just so lit up, and so I think this happened on a Saturday, and it was a Saturday that I wasn't here. And so I was able to, over the phone, tell my assistant that I wasn't usually, the one I didn't work with usually, how to use it to apply to that patient, and she walked out of here happy. No shots, no drugs, what's not to like? So it's very helpful. The patients love it. It's a cold laser. It's very non-invasive. It's a great practice builder. in terms of our patient are asking about it, and so we're actually able to have patients referred because of it. And so it's great all around. I can't say enough about it. I banged up my knee. There was I could have sprained it trying to, you know, wrestle with my kids, or a little, you know, trying to do some basketball moves like I did in college, but I'm not in college. And either way, that was able to help reduce that pain, because, you know, I wanted to try it on myself to see that, you know, what I could prescribe to my patients, and it really does work. I mean, you know, you could hear it secondhand, but to have it work for you, that's, you know, that's all you really need.
All right, I'm starting to notice, and everyone, like I said, it's a repeating pattern. Everybody I've talked to, they all use it on themselves. They all use it on their friends. Some of the things you told me during the last break we can't really talk about, but you've even said that you've had a chiropractor that you were personally going to use it on you and use it on his staff with incredible results.
Absolutely.
So this is made by USA Laser.
Yes.
It's called the Lumex. If I want to, can I go in and just ask my doctor if he has it and demand to have it used? I mean, how do I find somebody that has this laser to see if it can help me?
Well, hopefully your doctor will have it, and if your doctor doesn't have it, you might ask why he doesn't have it.
To me, and again, I may be way off base here, but if you're a doctor and you mentioned to me that you had shown somebody, he didn't get the laser, the doctor you showed, he knew how it worked, but if you're a doctor and you know of it, you've seen it, experienced it, whether there's a million reports out on it or not, if you don't have it and you're not providing it to your patients and you know about it, to me, you wouldn't be providing the best care possible. Is that safe to say? Is that a fair statement?
Yes, it is. That's safe to say.
Now, you told me in your practice you do TMJ.
Yes.
And you told me with the TMJ you did surgery for a while.
Yes.
And you use the laser now?
Yes, I do. I believe that this laser has cut my TMJ surgery back by about 80 to 90%. In other words, this technology will help to avoid surgery. And being a physician, I only practice in the TMJ world, but I've also been able to help treat carpal tunnel, plantar fasciitis, sciatic back pain, to the point where these patients have not needed surgical procedures.
All with this laser?
Yes.
No side effects so far?
No side effects.
2 years?
No side
100
effects.
people, 1,000 people? How many of you put the laser on?
Hundreds.
And nothing?
Nothing.
Put it on good skin, you're fine?
That's it.
Put it on bad skin, it helps it get better?
Yes.
And you use it in your facial surgeries, you use it in your jaw surgeries, you use it in everything?
Use everything.
Well, I want to thank you for coming in. This has been, you know, I tell you, I interview people all over this is probably one of the most revolutionary things I've ever seen. So again, thank you for coming in.
Thank you.
You've been watching Medical News Network. I'm Mike Wittgenstein. For further information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.